insurance.
Ayo, DSP projecting here, and did you notice I'm not laughing about health insurance? And to be honest, I'm not really sure why Phil is, considering his wife's situation.
But it is what it is. Now, eventually, if it doesn't fix itself, yeah, I'll see a doctor. Okay? And, how long? I'm probably going to wait a while and see what happens, right? Like, it's funny because, again, sometimes it's different. Like, some days it's just neck pain. Some days it's arm pain. Like, for a day or two, I actually had a pain right here, the top of my arm here. That's because it's the nerve. When the nerve gets constricted in a different way, it'll hurt you in a different way. You know what I mean? So yeah, it is what it is. It sucks, but what can I do? I'm doing my best, without having to go to the doctor. If I have to go eventually, I will. But for now, I'm just kind of dealing with it. Like I said, with the way American healthcare works, right now, if I would say, I need to go to the doctor, and I contacted my health insurance, they would say, well, you can't just go to the doctor. We got to get you to go to one of these walk-in clinics first. So drive 45 minutes to a walk-in clinic each way. Okay, so I go to the walk-in clinic. I would explain the problem. The person would just do some basic tests and be like, okay, now I'm going to refer you to the real doctor. Essentially, the walk-in clinic visit is a complete waste of time. It's just to make sure you're not lying about your condition. You're not some kind of a hypochondriac or whatever. So then they'd probably give me the specialist referral, and I would hope to get in there soon. But when I tried to do this years ago for my ear infections, the earliest appointment they had was 2 months. I hope that would not be the case. I hope that I would be able to get a relatively fast appointment, but you never know. Okay. What's up, King Michael? How you doing, man? All right, continuing on. And by the way, for the record, we don't have anything else formal to really talk about today.
By the way, for the record, we should formally talk about how he's putting his dent's health at risk in case they actually listen to his quote-unquote advice. First off, why is he contacting his health insurance just to go to a doctor? And second, even if he is contacting his health insurance to go to the doctor, I don't think they would tell him to go to a minute clinic. They would probably say something like, you're a 43-year-old man who claims to have chronic back pain. You should already have an established primary care physician, or PCP as I like to call him, with whom you can make an appointment with directly. And yes, the PCP would likely need to give a referral to a specialist, but not after you pass some type of hypochondriac test, but after the doctor does a preliminary diagnosis to ensure you'll be going to the appropriate specialist. Because DSP isn't a fucking doctor. The doctor is.
We got more shout-outs to do. Holy crap. Well, first off, yes, I saw what happened on Kick, but let's shout out this other tip. There's another $2 tip here. I'm going to read this one. Someone tipped $2, says, why can't you just be honest with us? It's hurtful that I've been lying, and I don't mind doing big support if you tell us where the money is going. All right, you want to know where the money is going? Ready? Here's where the money goes. You want me to outline every single thing? Let's see. Let's start. My money goes to all my ongoing bills. So things every month that I absolutely must pay, like my mortgage, okay? Like health insurance, like the utilities, right? The basic stuff that everyone has, right? Money also goes to support all the people and creatures in my household, so food for everyone.
At least money is going to health insurance, but we'll get to those specifics in a moment. I want to point out that on 16 February 2025, DSP said there are creatures, plural of creature, living in his house. This would be a full month before the Keno Casino does their Dead Rabbit reveal on around 15 March 2025. This could mean one of two things. He was referring to his wife as a creature, and this theory is supported by at the end of his rant where he mentions food as one of his biggest expenses. Going from swimsuit model to DSP's latest victim clearly took a decent amount of calories, which Cat's quote, shit job, unquote, probably couldn't pay for that food. But we'll get to that quote later. Because the second thing he could have meant by creatures was his soon-to-be dead rabbit. All roads lead to DSP telling on himself, or having abusive tendencies towards his wife.
It's no big deal. No, it is a big deal. Okay, it really is a big deal. Now, here's the other part, too. And this is the part that I absolutely have to add some commentary to. Did you notice that in this article, or in any article at all, that you read about the job growth in the United States, okay? Did you notice that they never say the quality or type of job growth? Did you happen to notice that? Nowhere here does it say, oh, they were in these particular sectors. In fact, what they actually did, they excluded the farm sector. They definitely did that. They said it's not farm jobs, right? But outside of that, does it say one little piece of information about the jobs? No. No, nothing at all, right? Why? Why? Do you want to know why? Because the jobs that they report that are job growth in the United States are not the kind of jobs that you can make a living doing. The jobs that they are reporting as job growth in the US, all right? Do you think it's a job where it's a factory job where you have a skill that you learn and you can apply it to a product and the product is great and so that company appreciates you and you can get healthcare and you can get investments like retirement investments and you can get promoted and you can actually have like a career doing that? Is that what you really think the jobs are that they're reporting? Do you think that the jobs are office jobs, a cushy office job where you sit in a nice comfy chair all day, doing data entry, answering phones, going to the boardroom meetings, talking with people, again, healthcare, retirement opportunities, things for your family, investments, and then promotions and career? Do you think that's the kind of jobs that they're talking about when they say, oh, our economy grew by so many jobs? No. No. You want to know what jobs they're talking about? Fast food. You want to know what jobs they're talking about? Retail stores. You want to know what jobs they're talking about? The gig industry, where you drive a car and deliver food or pick someone up on an Uber. That's what they're talking about. These are jobs, all right, that you can't even get hired full-time for the most part. So you never qualify for healthcare. You have to pay for healthcare out of pocket, which is insanely expensive in the United States. For those who don't live in the US and you don't know how our healthcare works, unless you have an actual healthcare provider through your job because you work full-time, 40 plus hours a week, you have to pay for healthcare out of pocket. I can tell you, I am healthy, okay? No major pre-existing conditions. I pay over $400 a month for healthcare just to have it. That's not me using it. That's just to have it. Then if I use the healthcare, they charge me again for the visit, for the medicine, for anything. I get another bill and another bill and another bill, okay? If you have a pre-existing condition in the United States and you need healthcare, you're going to be paying $1,000 a month for your health insurance, plus the cost of care. That's how our system works in the United States. You literally must be rich to have healthcare, okay? It used to be, well, your job would do it for you. You get a nice job, and because you work full-time for your job, they've negotiated with these companies to get discounts on healthcare so you can afford it. No jobs like that exist anymore. They've done away with them. They outsourced all that work to other countries, and now the only jobs that are left in the United States are less than full-time. So we're talking you're scraping by to maybe get 20, 30 hours a week at the job. No healthcare, no benefits, no retirement packages, no opportunity for advancement or any kind of career. You're lucky if they make the fucking work schedule more than a day before you're expected to report to work. So you can't even have a life because you don't know when you're supposed to be at work, how many hours you're working this week, how much money you're going to make this week because your schedule is constantly fucking changing. That's the jobs that we are adding to the US economy. Shit jobs that no one can make a living working. So many Americans are now being forced to work 2 jobs, 3 jobs, and juggling between them.
Where some clips combine DSP telling on himself and his abusive tendencies towards his wife. Quote, I pay over $400 a month for healthcare just to have it. Let's break this down. It's a definitive statement. He's paying for it. He has it. Pretty clear. Unfortunately, $400 in the United States for healthcare is actually pretty cheap, so it's probably some kind of high deductible plan, which lines up with why Phil doesn't establish a relationship with PPP. I mean, his PCP. But that's neither here nor there. It's clear he has it and that he pays for it. But for his example for the retail worker with their shit job, who specifically only finds out their schedule a day in advance and sounds suspiciously like Kat, and I quote, "You're going," unquote, to be paying $1,000 a month. To me, especially when juxtaposed next to how definitive his first statement reads, Kat's going to get health insurance in the future, implying she doesn't have it now, and when she does get it, she'll be paying for it, not him. But that's just talk. Maybe he texts his PCP about Kat's health. No, wait, it's PPP he texts about not being able to afford tests for his dying wife. Full text on screen for my audio style listeners. I read the pertinent parts 2 videos ago, and honestly, it's too sad to read again. Because after he mentions how he couldn't afford the test and had to delay it, he says he's going to buy a superfluous computer instead of saving money for other tests, which are going to be necessary if the first test didn't find out why Kat is down with the sickness. I want to be very clear to all my viewers who live outside the US, not having adequate health insurance here could very well be a death sentence. Pair that with a degenerate gambler of a husband who will never let you divorce him, not because of the detractor W, but because a divorce lawyer would notice that the $5,000 a month in business expenses were JPEGs and not health insurance, and she would get everything. Man, this shit isn't even funny anymore, so feel free to leave some jokes or wild speculation in the comments. As always, thank you for watching, and deuces.